information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to An Impact on Your Health. An Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. An Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. An Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, well, it's a get 'em up out of the year version of the show. This is New Year's Eve Day show. This is part 2 of year 2010 in review. We kicked this off on Wednesday and got through, actually the first 5 months. We got 1 month behind ourselves, got a little carried away. We're going to pick up the pace today. We're going to move onward, and we will get to the month of December 2010. What I intend to do, if you haven't really done this with me before, is just pick up my calendar schedule. And I start flipping through, and I can see the dates where we had specific guests. I'll remember specific key points that were brought up by that guest. You, if you do frequently listen to the show, will be triggered to remember equally as well as I what those key points were. You may want to just jot down, go get a calendar of your own and go point for point with us, especially if you'd like to listen to previous shows and don't want to have to search for them. Boy, if you have your calendar with you, put down the date. You can go to the website at dennisjcourtney.com or amikimpact.com, and opening page, there is an icon marked Archives. Click on it, and then just scroll down to find the date that you have in mind. Click on that, and you'll be up and listening to the show as we did it on that day. There's 4 years plus worth of shows on the website awaiting it. So, without let's do this. Let's talk about who we got coming back for you when we get back here on the 3rd of January. January is a pretty filled up month in terms of guests, so you get ready for a rip snorter. We're going to kick it off with some fervor. Here, I finally do have it page open. Yes, on Monday, January 3rd, Cass Ingram is going to be back with us. He's going to be talking about a topic that I'm going to nail him on. He wrote a tremendous book not too long ago, entitled Natural Cures for High Blood Pressure. We'll speak about the way he sees it, and you get some pretty good ideas for how to nip this in the bud. Then on Wednesday, we bring her back. I'm talking about Dr. Susan Smith-Jones. She's going to be talking about stress busting. She says there are 7 particular stress busters. Good way to start off the new year, 2011, is it not? Then we just inked this young lady. She was with us once before on the 10th, Rena Revivo. Now she is, I went to the website and I was looking her up when she was with us the last time. She's drop-dead gorgeous young lady. I told her publicist, you got to get her on TV, heck with radio. And in the meantime, since I've spoken to them, that in fact has happened. She's returning from her mother country, the Middle East, and where she spent Christmas. She's going to be with us on the 10th talking about, ladies, cosmetic issues with using natural substances. You'll want to not miss that show. Rena Revivo returns with us on the 10th. On the 12th, Stuart Reeves is back with us, the representative from Epicor, originally affiliated with the company when it was just called Diamond V and made veterinary feed for various livestock throughout the country. And then the big discovery came. He elaborated on how the discovery was made. We're going to be talking about the immune system. A lot to do with the immune system in 2011. We've got to get rid of these approaches where we boost the immune system. That is a key way to look at what not to do with the immune system. And it's a new nuance that I believe we're going to be playing on in the year 2000. You just got to get hip to the fact that you want to modulate and balance immune. You don't want to boost immune, and there'll be more information and research supporting that as the year goes on. On the 17th, Roland Thomas comes with us, a new guest to the show. His background, we'll get into that further on the day, but you can tell by the topic. Listen to this one, bioengineered algae. Okay, that would be one that I would be hesitant on scheduling, but you know what? The byline here is soon to be our most powerful food and medicine. You know what? He may have a point. We'll find out when we talk to Roland on the 17th. On the 19th, we're looking forward to starting a relationship with Trace Mineral Research. Darren Starkey, a naturopathic physician, literally I thought he was out in the West Coast. He's in Virginia. Anyway, he's going to come aboard. We're going to be launching our relationship with Trace Mineral Research. We have our gentleman friend up in Indiana who'll be paying attention on that day too, and he'll be giving us a call. We'll plug the three of us together and have a good old time on that day. And that's the way it stacks up as it stands right now. So look, to get this in us in the proper frame of mind and to be able to switch gears, so to speak, why don't we take a short break right now? I want to get on it and move quickly as we return. We're going to be talking about 2010, the year in review. We're going to be picking up with June because we left off in May. Get those pencils and papers ready. Pull out a calendar. You take the walk with me, and you'll have all of 2010 laid out for future reference. Be back in a moment.
Got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Oh, sorry, I gotta go. Love you.
We can do this. We can cut the fat food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit of a spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruits with herbs and minerals. We could add some to our breakfast protein shakes. Fruit of the Spirit is a unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call
1-800-442-3793 for a special promotional offer. Fruit the Spirit, a blessing for your good health. Fruit the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, ladies and gentlemen. Welcome back. Slight glitch there. We got it all fixed up. I hope you didn't get discouraged as you awaited the return so that we can kick it off and move quickly down the remainder of the year 2010. Here, after all, we are at New Year's Eve Day, the 31st of December. We kicked this off. We started it all on Wednesday, got through the first 5 months, and now we got to hustle along to conclude our year in review, which we do each and every year. Hope you got your pencil, paper, and a calendar ready to go. Here we are now. We're in June of 2010, and right off the bat, first part of that month, as usually does occur when our great contribution to ophthalmology, Dr. Edward Condrat, comes to town. We usually try to bring him on our radio show to help alert you that there are alternative treatments for eye disorders that have a much better profile than many, if not most, of the conventional ones. Ed comes to town with his whole dog and pony show and ends up doing a treatment seminar 3-4 times a year even. Well, on the 4th of June, we brought him to the show because he actually came in town that weekend. And on the 7th, they had their little get-together out at the Marriott near the airport. I'll keep mentioning it when Ed is coming to town to alert those who want to seek alternative treatments. If you feel like you'd like to jump the gun a bit and not really wait for Ed to come through me to get to you, give me a call at the office. I'll be happy to pass on his office information to each and every one of you who has an interest. Okay, so the month clips along. A very interesting gentleman comes our way. In the third week, a gentleman who his claim to fame was, and I'm still certain is, that he had attained the age of 108 when he came to visit us in Pittsburgh that week. He was the featured speaker up at the Freedom of Choice in Cancer Therapy Group on that Thursday. But on Monday, we had an opportunity to bring him to us here on our radio show. I will say that the voice quality, if I remember correctly, was a little difficult, but it was a great lead-in to his visit. I understand, and just recalling the notes, the personal view that many of you had when he came to Pittsburgh. The gentleman, 109 years old, traveled all the way across the country. They said he was there for 4 hours standing, never sat down, had energy to boot the entire night, then communicated with guests. Anyway, his message obviously is a powerful one, and take me up on returning to memory lane and spending some time with Bernardo Lapayo, who was then 108 and is now 109, and I'm sure we'll have him on the show when he hits 110. Then as the month moved on, our good friend, and we've had her on the show many times, she's just a joy. You can tell when speaking to Willie Jean, and you all know her as the lady with the Bayou Remedies, comes with us about 2 or 3 times a year. Her company on her website, I would say the best advice I can give you is natureslegacy.net. natureslegacy.net will allow you to gain entrance into her domain with all her unique herbal supplementations. In particular, we learn each and every time the prime importance of the May apple, which is pretty much available here in the Western Pennsylvania area. Anyway, Willie Jean Carrington put this on the 23rd. You may want to jot that down. Now, in the last week of the month of June, some real special things occurred around here. We teamed up and did 2 shows back-to-back with a good friend of mine, physician, mentor, absolutely a treasure of medical information. He's acquired over 30, 40 years worth of practice. I'm talking about Dr. Roy Carey, who came to our show on these days, 28th and 30th of June. And we just spent the time each and every one of these days going over what I believe is now, and after having done this in the last 6 months, which was the whole idea for launching it, thyroid treatment around here is a lot different than it ever was before we met Roy Carey. I hope if you have questions about the way we treat thyroid, utilizing what I affectionately refer to as white lightning. If you don't know what white lightning is, then maybe you better dial up and listen to the shows. If you do think you have a thyroid issue, and by the way, women especially in Western Pennsylvania, if you don't think that you have a thyroid issue, then you are very much mistaken. We should quickly bring this discussion to a close, at least for now, by saying you cannot trust, do not trust the blood test for determining whether or not you need thyroid treatment. It just won't happen for you. Too many people, put it to you this way, only a very small percentage of women who require treatment actually do have abnormal test results. And in fact, as I said just yesterday with a gorgeous young lady who was in here with thyroid affliction, and her lab work was normal, by the way, and could never get anyone to treat her for her thyroid disease. I would say this: if you actually do have abnormal blood testing that would be a tip-off to your physician that you should be treated, you are so ill by virtue of that small percentage that you now occupy with diagnosable thyroid disease that I feel very sorry for you. Thank goodness that you got some treatment, but I'm talking about the 90% of the other women who don't. Take me up on reliving the whole saga of how we developed this treatment through the kind guidance of Dr. Roy Carey. He'll be back on our show, believe you me, in 2011. I've already spoken to him about it, and we'll be looking forward to bringing him back. Here we are in the month of July. I turned the page on the month of July. I'm looking here, and I think that, I'm very well known for my busting of the fallacies when it comes to even alternative therapies. And if there's one that I absolutely have to take responsibility for, it's my exposition of what's up with vitamin C. Not too many people happy with me in the years gone by, but every so often we've got to go down and redo this story for those new listeners that weren't there when we originally allowed you to see behind the curtain to find out about vitamin C and how it really should be taken. Remember these 2 factors. If you remember these 2 factors, they're the blood and guts of the 2 shows we did in July. First, part 1 of vitamin C was on the 12th, and part 2 was on the 16th. It was a Friday, and the 2 salient points are only non-corn derived vitamin C is worthwhile and biologically active, and number 2, because it's so difficult to absorb vitamin C, you need to be looking for a fat-soluble form. Those 2 factors. But enjoy, if you care to go back and listen to 2 full hours done on this subject on July 12th and 16th. The reason why we didn't do them back-to-back is we had a really interesting guest on the 14th. His name was brought to our attention by one of our listeners, a constant listener of these airways, talking about chocolate. You probably know who I mean, because he's always calling up, and he does want to have a discussion about chocolate. He requested, hey, you really should get a hold of John Michael at Love Street Chocolates here in Pittsburgh, and we did just that. Organic chocolates made from raw organic ingredients. If you have a mind, if you have a sweet tooth, and you literally want to make your sweet tooth a medicinal function, a natural function, you'll want to listen to John Michael on the 14th of July and just enjoy having an opportunity to hear him explain how he makes what he makes. It's now, I believe, nationwide. I think it should be across the country. And it all started here in Pittsburgh. Let's see. We had Cass Ingram on the 21st. He frequently comes to the show, folks, and he had an interesting topic at the time because this was the time of the Gulf oil spill. And he had a unique theory that I thought, had quite a bit of merit associated with it. He entitled his show, How to Survive a Toxic Summer. What he was referring to is that all of these petroleum vapors were being sucked up into the atmosphere, and as the cloud formation included them as part of the particulate in that thing called a cloud, they were ultimately going to dump those kinds of toxic agents, those vapors in the form of rain over us. And so he was forewarning us of the dastardly possibility that harm was coming to us in the toxic summer of 2010. Okay, then on the 26th, we talked about, we had a topic. You may want to go over it again. The first part of this topic was due to an article that I came across. It was interesting. I always feel that to make you a better consumer when it comes to your medical care is part of my mission here. And something came by me by the way of this topic. 8 secrets that your local hospital doesn't want you to know about. Well, we talked about the 8 secrets. I don't remember what all of them were, and I'm not going to elaborate them now. But I will take a moment to talk about another part of that show, which was the byline of Know Your Anesthesiologist. I'm going to repeat something that I did that day because each and every time I meet a new group of people, there's a segment of those patients that remember this show. And I want you to take this in the right way when I say know your anesthesiologist. But when it comes to surgery and the use of anesthesia, now you have to take it from a guy who is an anesthesiologist. I made the point that as far as anesthesia goes for surgery, and as an anesthesiologist would want to tell you, the last form of anesthesia that I will allow given to me if I require surgery would be a general anesthetic. Going to sleep, yes, I know, and the majority of people that I ever discussed anesthesia with said just, hey doc, I don't want to know a thing, just knock me out. Well, that's a pretty simplistic way to face what literally are a whole bunch of risks that can be avoided by other forms of anesthesia. I'm not really going to elaborate on them today, but the top of the list should be local anesthesia only. Number 2 should be local anesthesia with IV sedation. Number 3, in the order of importance and request on your part, spinal anesthesia. And in the last category, the ultimate last category, is general anesthesia, where you actually get, well, you say, knocked out. Those words are really backed up by a whole bunch of literature and research over the years that lead me to conclude that I pass it on to you now and wear it in good health and hopefully avoid a general anesthetic whenever possible. Okay, flipping through July, into the month of August. Here we go, plodding along. How are you coming along with it? Are you writing down these dates? Are you keeping track of our guests? In the very first slot in August, on August 2nd, we had a young lady come aboard with us talking about how to slim down that stubborn double chin. Now, she had an interesting way of doing it. I mentioned it to you today because I think, you know what, there are many ladies out there who are very concerned about this, not so much the men, but definitely the ladies. Her name was Vicki Southard. You'll find her show on in the archives on August 2nd. Take me up on taking that walk down memory lane with us. Okay, month went on. There were a number of repeat shows that we did. I see we repeated the vitamin C shows back to back. Then we got to the third week. finally a gentleman who, well, we've certainly made contact with a number of years back. His name was Jim Navarro, his famous son, now deceased son, Thomas Navarro. A biography and a documentary film was made of Thomas Navarro's saga, his life, and all the elements surrounding the very turmoil that really gripped that family through that beginning. It was around 2000, 2001. We followed it closely then, and we brought Jim on the show to talk about the documentary. You can find out more information by either listening to that show or because there's so many new things coming up. I refer you to www.cancerbusters.us because whatever's happening in the arena of the bill that he is trying to get through Congress on the Thomas Navarro Patient Rights Act, as well as the ability to see a viewing of the documentary film, it'll be on the website. We'll be bringing them back shortly as the year progresses. They had asked me, as well as Beth Clay had asked me, to come back when the new Congress convenes, and that's literally around the corner. Okay, on the 25th, I put a little star here because, well, he's an important friend of mine. He's got powerful messages when it comes to the cardiovascular. I'm talking about James Roberts, who every so often we get to bring him on our show after I get through the myriad of ladies wearing football pads in his office to put up a buffer zone around him. It's tough to get to Jimmy. But he spent a day with us on the 25th talking about a number of things, but in particular, atrial fibrillation. This is a very much important topic to a lot of my patients who suffer from AFib and are concerned about being put on Coumadin, which is the conventional medical way of dealing with it. Jimmy really revealed that that is not really necessary in the highest percentage of those cases. He talked about a new evaluation system, a categorization based on category 1, 2, 3, and so forth, where categories 1 and 2 don't require any Coumadin at all. I refer those who would like to listen to what those recommendations were to go back to the show of August 25th with Jimmy Roberts, talking about many things, of course, but in particular, we heavied up on AFib because at the time there were a number of people who asked me to question Jimmy about it. Always enjoy his responses. They are always to the point. He never shirks any topic, and particularly this one. The book that I will refer you to, where a lot of what he told me on the 25th is even documented, is called Reversing Heart Disease Now. It is a must-own by anybody out there, I say, who even thinks about trying to get an edge with cardiovascular disease. By the way, as a little plug for what we do around here, we had done and we continue to do everything in that book that is written about and has led to some humorous encounters between Jimmy and I, because I told him that literally he and I could have authored this book. Why did he need Dr. Sinatra? Well, obviously you know why. But nonetheless, Jimmy Roberts on the 25th, dial it up again, if you have a mind to. Then in that same month, our first introduction to a female pediatrician who brought us an interesting concept that has, in many patients' minds that have taken her up on her little invention, have backed up her assertions 100%. I'm talking about Dr. Hannah Solomon. She prefers to be called Dr. Hannah, and she instructed us in the use, the need, and the benefit of something called nasal washings. Now, the best way to sum up this thing about nasal washing, it literally is you got to clean out the mud in the pipe before you can have anything freely flow through it. The mud that she refers to is all the sludge, all the mucus, and all of the other debris that accumulates in the nasal passages, which can easily be washed out. She said then that you could teach a 2-year-old to do this in a matter of 20 minutes. And I had a little unit sent to me, and actually, she's right. I would consider myself, when it comes to literally inhaling liquids, as a 2-year-old, but it worked just fine for me. Many patients swear by it now. Nasal washings, by the way, keep coming up each and every time we're talking about how to avoid the colds and the flus and infections. The drainage and the cleaning out of the nasal passages is put on the top of the list from just about every expert that we ever speak of, and the most simple way to do it is through her little invention that allows you to do these nasal washings. You can find out more by contact. I'll give you a phone number, 877-853-7873. Once again, to get your device, the nasal washing device, very reasonably priced, 877-853-7873. Dr. Hannah Solomon. We call her Dr. Hannah. And we move on, and we move to the month of September. Well, in the month of September, Beth Clay finally makes it to us. She, of course, is the previous, I keep using the term, administrative assistant. I forget the exact title that she really was tagged when she was with Representative Dan Burton. Dan Burton from the state of Indiana was chairman of a very famous committee in Congress, continually bringing health issues to the forefront. I can tell you Beth Clay was his rock, and she was the one who gave him all the information so he could handle each and every one of those health-related meetings. Beth, since he had stepped down from the committee as the chairman, then left government in one hand and entered it in another way. She now became and is a lobbyist. So we were talking in particular about the Thomas Navarro Act, which she's intimately involved with. And we're going to be getting with Beth and Jim Navarro, by the way, as I already mentioned, as the new Congress takes the helm here in the next week or so. And so give them a month to get everything organized. We'll get with Beth and Jim to find out what the status of the Patients' Rights Act with Thomas Navarro. By the way, you should know, and I think maybe the omission of this is probably, I have to apologize for, the real need for the Thomas Navarro Act, if you don't understand it, should be in this little phrase. You as a parent are absolutely powerless in determining what treatments your child will receive. The government will tell you what treatments you're allowed to receive. You as a parent have absolutely nothing to do with it, when in fact you should have everything to do with it. And therein lies the rub and the need for the Thomas Navarro Act, which as a parent will put you in the driver's seat and give government the heck out of that driver's seat when it comes to the care of your child. And I'm sure you understand why it is so absolutely important to get accomplished. Anyway, they say in the new Congress they might exactly get that done. Okay, in that month also, this is our first visit with a gal who's going to be with us on the 10th of January, Rena Revivo. And she was talking about skin care horror stories and literally talking about all these chemicals that are in these skin products and how much damage and just dissatisfied users, at best dissatisfied users, with her natural line of products, which we're going to be talking about in January. We first brought them to your attention. Then, ladies, you do not want to miss the show that we're going to be doing on the 10th. If you'd like to, go back and re-listen to the show that we did on September 15th with Rena when she was our guest on that day for the entire hour. Okay, moving right along then. Got to the end of the month, and based on an article by Joe Mercola, and I'm not going to elaborate on them, but there were 12 medical myths that we took the time. We did 3 shows on these medical myths. They were interesting to delve into because they got to the very crux of the matter, many of which, these matters, we had already raised in our discussions as we meet each other 3 times a week. But to have Joe document them all as the 12 medical myths was a great way to handle the byline for what not turned out to be just one show. There were 3 medical myths. Part 1 was accomplished on September 20th, Part 2 on the 24th, and Part 3 on the 27th. A good trilogy, as I always like to have these medical topics follow, a trilogy and always like to be able to have you go down memory lane, take a listen to those if you have a mind to. September 20th, 24th, and 27th. I see sandwiched in between there, when we had him on our show too, is when Cass Ingram came to town. That was in the month of September. He spent an entire evening up there at the Freedom of Choice and Cancer Therapy group on the 23rd. We had him on the day prior. He was driving all the way from somewhere in the Midwest to come here to be part of the festivities on that evening up there. I've since seen a DVD of the of what he did up there. It's just amazing, the breadth of this gentleman's knowledge on health issues. Anyway, the 22nd is another show of Cass Ingram where he was on our airways, and we certainly enjoyed bringing him to you then. And once again, he's our first guest when we return from the New Year's Eve break, and he'll be our first guest on Monday. We're talking about blood pressure. All right, let's do this. We're going to take a short break just to let the whistle, come back. We're into the month of October, November, December. I've noted a whole bunch of shows. Oh, I can see why. You know what happened in October. Think about it. October. One more clue. Pink October. If you don't know the answer, you're way far behind. Be back in a moment talking about 2010.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back to AM Impact on Your Health here on this Year in Review show, year 2010. Of course, we're here with you on New Year's Eve day. How appropriate to bring 2010 to a conclusion by looking back in time and seeing, who were the guests, what were their salient points, what issues do I recall, just happened to see their name as a entry in my calendar book. And it's interesting that we do this each and every year, and we have done it each and every year. So today, after kicking this off on Wednesday with the first, 5 months of 2010, we're here with the remaining 7 months. We're up to the month of October. You should have a pencil and paper with you. You really should have a calendar with you so you could literally circle and have a very good compendium of all the shows that we did in 2010 to be able to just dial them up once you know the date and reach them in the archives found at my website, DennisJCourtney.com or AMImpact.com, opening page, click on the icon marked Archives, and then just scroll to the date in question, and you'll be able to listen to the show as we did it live back then. We're in the month of October. I look at this, and there's yellow marks, which I was using to highlight the specific shows that I wanted to talk about in this review. And there's yellow everywhere on this particular page because, as you now know, knowing me as well as you do, October is a month that really gets my goat. Because if you didn't get the clue of pink as the reason for it, October is annually Breast Cancer Awareness Month. And I've often said, and I continue to feel this way, that when the fountain turns pink, talking about downtown Pittsburgh's Three Rivers Fountain, which does actually turn pink on October 1st, commemorating for the entire month this thing called Breast Cancer Awareness. When the fountain turns pink, I turn red with enragement. I think this is I like the idea of breast cancer awareness. Do not get me wrong. I want women to absolutely have these protections in. What I don't particularly agree with, and not particularly at all, I'm adamantly opposed to the use of mammograms and the use of mammography in order to delineate whether someone has or has not breast cancer is a dud. It is a flub. It will not do the job. And the reason is just this. Once again, allow me the indiscretion. If you already know what I'm going to say, then see if you can say it in the exact same words. The mantra of breast cancer is that early detection is your best protection. And I absolutely agree with that. It just so happens, however, that the mammogram is not the tool to be able to early detect anything. In fact, it's held to about a 1 centimeter standard. And if you know about the Courtney 1 millimeter rule, and that would be another thing I would ask you to be able to recall and recite by memory. 1 millimeter rule goes something like this. Anytime a malignancy has attained the size of 1 millimeter, well, it's already off to the races. It's already metastasized. And so by finding a lesion on a mammogram at 1 centimeter, it's already 10 times larger than that 1 millimeter, and it is already off to the races. The fact that medicine will go through its kabuki dance, saying that you need to have a repeat mammogram, a sonogram, a biopsy, and lumpectomy, maybe mastectomy. And after it's all said and done, the surgeon tells the family, look, we got it all, but by the way, chemotherapy begins on Monday morning. And it's a little bit of a loop as to, if you got it all, why would you have to do chemotherapy? And the reason is that they already know that there's metastasis somewhere. And they didn't get it when they removed the lesion from the breast. And the mammogram is only going to be helpful to delineate a lesion in the breast and at a size where it's already too large to have been able to help you out with the early detection. There is no early detection with mammography. It's late detection. And there's a number of false positives that go along with that too. So throughout the entire month, I'm just looking at various dates. I'll give you an idea of what was discussed. All the breast cancer related issues go something like this. On day one was the kickoff. I was feeling enraged because the fountain did turn pink, although this year we didn't have a truck driver actually call us up who saw the fountain pink as we had done previously. We had the mammogram fights. That was on the 6th. It was between Dr. Goffman and Dr. Alvarez, if you know what I mean. Goffman, a very prestigious scientist. Dr. Alvarez, Manny Alvarez, I'm going to keep it clean here, folks, a gynecologist who, he's on Fox Network, and he was trying to say how wonderful mammograms were. It caught my ire. It got my dander up, and I had to come in and vent to relieve the pressure with you all, and I did that on the 6th. Then on the 8th, I took the time in my own way to talk about mammograms versus the real, I think, illustrative way to early detect, which is a thermogram. I did that on a Friday, the 8th, because I knew that on Monday, the 11th, the girls were going to take it away from there because they are the gals who do the thermograms in my office. They represent a company called Three Rivers Thermography. They literally travel all over western Pennsylvania. You can listen to their show on the 11th, but I can tell you what, I'm going to give you a phone number to their office. If you're in my area, which is in the South Hills of Pittsburgh, I may be the geographically desirable location to get a thermogram completed. But if you're someplace else throughout western Pennsylvania, and I literally mean throughout the entire area, these girls travel so much that they are in your backyard, and you can get the thermogram done there, and you don't even know it. So in order to be able to find out if they are actually in your backyard and how close that backyard to you actually is, the phone number, 412-548-3612. Ladies, utilize it. Make sure you get that thermogram, and you get one each and every year, because you truly will be protected by doing so. So that was on the 11th. Then on the 13th, it was an interesting show we did. We did a three-way that day. I had Peter Beltram, who is the CEO, president of Neuromed, literally the manufacturer of a unique device called the Matrix device. Also with us was Mike Gramazio, a clinician who's been working with the Matrix device for the last 15-20 years. And we introduced this neat little nifty piece of machinery able to deliver a nerve block without the use of a needle. We use this technique in my office, have been doing so for years, never really brought it to your attention. If you have a pain problem, whether it's acute or chronic, so if you're just recently injured and have an acute problem and just looking for a way to get some relief, or a chronic problem for which you think that there's no way to get relief, I tell you, give us a call. Come on in to see us. We'll give you a trial on the Matrix. At a minimum, I believe that greater than 80% of you will have a very interesting modality at your disposal that you currently do not have, and that you'll be able to utilize in the best way possible for you. We followed up that show on Friday, the 15th, 2 days later, with a gentleman, a colleague of mine, another anesthesiologist, happens to be working at a same-day surgery center in Akron, Ohio, and that was a day we spent some time with Dr. Frank Crusade. In that particular show, he was talking about his use of the Matrix. It paralleled mine. It was two doctors literally comparing notes about how they manage chronic pain problems, and the fact that he relied on the Matrix so much as I do was just another nail to close the door on how effective the Matrix can be from one clinician to another. If you do have a pain problem, you're looking for an edge, you're looking for a way to be able to get relief in a way that you never thought possible, you may want to take us up on, first of all, learning about the Matrix by dialing up those shows, October 13th, October 15th. And if you really are intrigued by what you hear, then give us a call here at 724-942-3002, and we'll see if the Matrix works for you, because literally we'll know in 20 minutes. How about that? Okay, moving on. This month of October was jam-packed because we kicked it off talking about cancer. In the middle, we talked about pain, but boy, we came at the end talking about cancer once again. You see, the guest at the Freedom of Choice in Cancer Therapy group was one Bill Henderson. And Bill Henderson had written a book on how to become cancer-free. And his intention was to give those who have a difficult time finding a doctor, who are out in hinterland and don't have any, literally many conventional doctors anyway, and certainly don't have any alternatively minded doctors. Bill Henderson came in his book and talked about how to become cancer-free, and we spent the day with him on Monday, the 18th. Then, on the 20th, and for those of you who would like to explore this matter further, I absolutely refer you to the show we did on the 20th, where I did some research, and I came up with the 9 in-home cancer remedies, and I spelled all 9 of those out in the show that we did on the 20th. It is very enlightening to see what they are and what each of those 9 therapies actually accomplishes and how it does it. But of course, you are not in a land where you are devoid of alternative doctors, and as such, I wanted to make certain that you understood how cancers really need to be managed within the context of a medical practice as a medical doctor. And so on Friday, I talked about not the 9 in-home cancer remedies, that was done on the 20th. I talked about the 7 unavoidable steps in order to manage cancer treatment literally medically. And so those 3 shows, I think, give one a well-rounded look at how you should attempt to take on and conquer this dastardly disease called cancer, whether it is through elements that you'll use on your own or in conjunction with the medical community, a medical representative, a MD, such as myself. Well, we'll always leave that up to you. However, the fact that you have so much information available to you in that week, 18th, 20th, and 22nd of October, it's nice to be able to pass it on to you so that you can use it in your best interest now and into the future. Now, moving into month of November, that was just, so not too long ago. Looking at our schedule there in the month of November, we had Rick Hill back with us. He was initially here in the month of February, you'll recall from our previous show on Wednesday. He's a gentleman who had testicular cancer, conquered it, which was a feat into itself, especially in the day when there really was not any good cancer therapy for testicular. Now there actually is. But then he represents a company for air and water purification called Healthy Perceptions. We talked about it. We have many of the products literally here in our office, and so Rick was with us on the 1st. We talked about memory loss quite a bit because on the 3rd, the 5th, and the 8th, all dealing with memory in various capacities, we wind up on the 8th with Mark Underwood. He, of course, is the founder, and we had him earlier on in the year, of a product that he manufactures called Prevagen. Comes from jellyfish. You'll remember him now. And the ability to provide you a calcium-binding protein that comes from the jellyfish to help stop and reverse memory loss issues. So those dates, 3, 5, and 8 of November, really cover the memory loss issue pretty well. On the 10th, Mr. Energy himself, Charlie the Fox, was in Pittsburgh. We got a hold of him on Wednesday because on Thursday he was going to be the featured speaker at the Freedom of Choice in Cancer Therapy group. He certainly made the rounds. He actually stopped in my office. He was right across the street at Sunnybridge, stopped over here. We spent about an hour just kicking the things around. It was nice to see him again. He was nice enough to be one of the gentlemen who came to my seminar that we held in Station Square literally a number of years back. It was nice to see Charlie again. Looked as healthy as ever, and he made a number of stops in the Pittsburgh area. You probably had a chance to see him in Monroeville, and there were a couple other places he wound up in besides giving that talk up there at the Freedom of Choice in Cancer Therapy group. So the 10th of November, Charlie the Fox spent some time with us. On the 15th, I mentioned the 15th, we met an interesting lady. Interesting lady who wrote a book. The title of the book sort of says it all. The boy, she said it better in person when she was with us on the 15th. The name of the book, Silent Enemy, Environmental Illness and One Woman's Search for a Cure. And boy, did she ever search. I have to say that she's literally a compendium of all of the alternative therapies that you could ever think of. This lady had practiced them and practiced them to the hilt to conquer her environmental disease. She attributes the ultimate conquest was reached and attained by what is the Gerson technique. And she literally did go to Mexico. Everybody down there in Max Gerson's clinic was there for cancer. She didn't have cancer, but the treatment used for cancer, which is essentially nutrition, juicing and the like, and detoxing through the use of coffee ground enemas and the like turned out to be what turned the tide. But you got to hear this lady's story. She told him in a fascinating way on the 15th of November when she was with us on that date. Faye Houston is absolutely my favorite person for the year, with what she went through in her entire life. She's a British subject. I think that is if she's still a British subject, that'd be news to me. I think she's converted now as an American citizen. She lives in the state of North Carolina, and told her story by phone to us on that day. Well, on the 17th, Dr. Gregory Smith was here, sort of the pain doctor to the stars. He's out in L.A., and he operates a pain clinic. Another anesthesiologist friend of mine, that makes the third one we hooked up with in the year 2010. He'll be back on our show as we turn to 2011. We'll be doing some programs with him, and I'll let you, if you have a mind to, if you do have a chronic pain problem, you want to hear about a unique approach, then I ask you to dial up the show of November 17th and have a whack at it. Okay, moving along in November. 1 week later, we meet a guy, a doctor, a medical doctor, in the state of Texas, who brings us an interesting concept. The concept is essentially two things, I think. First was that we learned from him that disease is a blessing. Now, that was a new twist. And you know what? He really went and proved that it was a blessing. Number two, and I think the more powerful message of them all, was that you can kill and go up against any disease and win, because you have the power to heal yourself. Very powerful topic. His name was Dr. Peter DeWitt. We end up doing our trilogy of shows. The number 3 works for me whenever I get a topic that I think needs to be expanded. I'm always trying to work it around 3 different shows. Well, we certainly did with Peter DeWitt. The first of those shows was on the 24th. His message was so powerful, we did schedule him for 2 more shows, and they're coming up in the month of December, and I'll give you those dates too. But the first one was on the 24th of November, and we enjoyed having them there. With us on the 29th, Dr. Stuart Reeves was with us. He's coming back. He's the Epicor guy. In December, hey, Brian Foltz talked to us about standard processing on the 1st. We had Peter DeWitt back with us, and we had Mr. Oxygen, Ed McCabe, on the 20th. The bongos in the background signal my time out of here. Hope you all have an enjoyable evening. Be safe out there, ladies and gentlemen. We'll see you on Monday with Dr. Cass Ingram, talking about blood pressure and how to control it naturally. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
KHB wants you to know over 1 million Americans at risk of foreclosure have been helped by Making Home Affordable. Visit makinghomeaffordable.gov or call 1-888-995-HOPE to learn what your options are.
E3 Live Blue Green Algae is certified organic and kosher.